So I bet you're wondering, how do we treat gum disease? Basically, our goal is to remove the bacteria. If it's very shallow, it's just about us doing a cleaning, because the bacteria, when it hardens, becomes tartar or calculus. Even if you're brushing, flossing, using a water pick, you are not removing tartar and calculus. Yes, you're removing plaque, which means it's a bacterial mass that's on your teeth. So what we do then is we do cleanings and remove the bacteria. If you have very minor gum disease, or very minor bleeding, or very minor swelling, it's just using what we call a deep cleaning, where we numb you up, usually just by using a numbing rinse, where you rinse your mouth for 30 seconds and your mouth becomes numb, and we can do a deep cleaning without you feeling anything. However, if you have a very deep situation where there's a deep hole around your tooth due to the bacteria eating or having eaten away a lot of the bone, we have something called LANAP. That stands for Laser-Assisted New Attachment Procedure. It regenerates the bone, it kills the bacteria that's in your gums and in your teeth, and regenerates the bone to get rid of the gum disease. It is truly fantastic. So I look forward to meeting you. Have a great day, and can't wait to meet you.